Welcome to Conference NCLEX Review, LSC. We're going to be talking about some antihypertensive drugs and some drugs for heart failure. Now, hypertension, somebody could develop high blood pressure due to increased blood volume. So when somebody's blood volume increase, the person's blood pressure could increase. And therefore, increased blood volume can cause someone to become hypertensive. And therefore, if somebody becomes hypertensive, a doctor may decide to prescribe what is known as loop diuretics. Now, loop diuretics, these are the drugs that can cause the patient to pee. So the more the client pee or the more there's increased urine output, the client blood volume would increase. Now, one of the loop diuretics that they like to ask on the NCLEX is a drug known as Furosemide. That is known on the street as what? Lasix, that's the brand name. Now, furosemide works on the kidney. It works by preventing reabsorption of sodium, and therefore sodium stays in the kidney, and sodium draws water to itself and cause the client to pee. Now, since loop diuretics basically cause patients to pee, now they might ask you in the exam what time of the day is the best to for the patient to take loop diuretics. Obviously, it's got to be during the day, because if the patient takes loop diuretics at night, it could disturb the patient's sleep. Now, loop diuretics, for example, furosemide, they are potassium-wasting diuretics. They are potassium-wasting diuretics. And therefore, if somebody takes loop diuretics, they're gonna lose potassium. So the exam can ask you what are some of the side effects of loop diuretics. Obviously, hypokalemia. The client potassium level is going to decrease because they are potassium wasting. Now, normal potassium level is 3.5 to 5.0, and therefore, when somebody is taking loop diuretics, since the person's potassium level could decrease, as a nurse, it is very, very important to monitor the potassium level, because hypokalemia or decreased potassium level of less than 3.5 can cause what? Can cause arrhythmia. Another side effect is hypotension. Hypotension is decreased blood pressure. If somebody is hypertensive, the main purpose of the drug is to decrease the person's blood pressure, but the blood pressure level could be decreased further lower than it's supposed to, and therefore it is very, very important to monitor the client's blood pressure. Furosemide can also cause hyperglycemia. It can increase the person's blood sugar level, and therefore when furosemide is given to a diabetic patient, we have to be very careful. Furosemide can also cause hyperuricemia. Hyperuricemia, that is increased uric acid level, and that can predispose the client to develop gout. And therefore, since furosemide could decrease the person's potassium level, in the exam, they can ask you, what type of diet are you going to recommend for somebody who is taking furosemide? You tell the patient to what? Increase potassium level in their diet. So you tell the client to eat some food that contains potassium, like banana. Banana contains a lot of potassium. To ask the client to increase their potassium, the potassium level. So I say that if somebody is diabetic, we have to be very careful in giving furosemide, because it can increase the person's sugar level. Now, the same drug can also be given to somebody who has heart failure. Now, what is heart failure? Now, heart failure is a state of the heart. That is why the heart is not able to pump enough blood to meet the metabolic demands of the body. So if the right ventricle fails and is able to pump blood into the lungs, or the left ventricle fails, is not able to pump blood in the aorta, we say that the client developed what? Heart failure. So it could be right-sided heart failure or left-sided heart failure. So now let's talk about some symptoms of left-sided heart failure. So we know from message 1 and 2 that if somebody have left-side heart failure, the client will develop what is called pulmonary edema. So pulmonary edema is a manifestation of left-side heart failure. Now, obviously, if you have a lot of fluid in the lungs, you're going to experience shortness of breath or dyspnea. Also, left side heart failure causes what is called orthopnea. Orthopnea is having difficulty laying down flat. Because of the fluid in the lungs, anytime the client lay down with their head flat on the bed, they experience shortness of breath, and therefore the client has to use several pillows, or they have to elevate the head of the bed before they can sleep. And also they can develop what is called a pink florid sputum. So these are signs and symptoms of left side heart failure. So when somebody has left side heart failure, they come to the hospital. As a nurse, the first thing that you have to do, that NCLEX is going to ask you is what? You ask the client to sit up in a semi-phallus position. So you have to sit the client up before you give oxygen. So watch in the NCLEX. Where anytime you see a position as an option, right, you have to be very careful. Maybe that could be the first choice, because it makes sense. If somebody is experiencing shortness of breath and you put the person's head flat on the bed, before giving oxygen, it doesn't make any sense. You always have to sit the client up in a semi-phallus position first before you give oxygen. So after sitting the client up, then you give what? Oxygen. And you give oxygen. How do you know that the client oxygen is going? You got to monitor the O2 side. So we know that the normal O2 side is 95 to what? 100%. And then you give what? Loop diuretics, you give a furosemide. So you are giving furosemide so that the client will eliminate the excess fluid in the lungs. After giving furosemide, then you give what is called positive inotropes. Now, positive inotropes, these are drugs that will help the ventricles to pump. Now, digoxin is a positive inotrope. So, if somebody is hypertensive or somebody has heart failure, you could give what? The same drug could manage hypertension, and the same drug could manage what? Heart failure. So watch loop diuretics on the exam. They are potassium-wasting diuretics. They can be used for hypertension, and the same drug could be used for heart failure. All right, so this is a confidence NCLEX review LSC. Will provide the precise information that will increase your chance of passing the NCLEX. You could reach us on our website, confidencepass.com, or could email us confidencepass75@gmail.com. Contact us, and your journey to the NCLEX will be of a smile. Thank you.